We've been working with VSI for about 7 or 8 years. We share their offices in Bellevue, and essentially we work very closely with Scott or Gary or Larry to consult with them about their clients' test preparation needs. Many of the VSI clients with whom we work, we will do individual tutoring because as athletes they have schedules that are difficult to accommodate in our regular courses. But we also have several VSI clients taking our classes that we offer in both our Bellevue and Seattle offices. Usually we are working with them for 2 reasons. One, we want to help raise their test scores for admissions purposes, but because a lot of VSI clients are also eligible for academic scholarships, we work to raise their test scores to increase the level of the academic scholarship award. Right now, every college in the United States that requires a standardized test for admissions purposes will accept either the SAT or the ACT without prejudice. There are roughly 800 schools or so that do not require any standardized tests for admissions. But if you are applying to a school that is not test optional, you'll need to take either the SAT or the ACT. And the SAT is offered 7 times a year, the ACT is offered 6 times a year, and there's really no need to take both exams except in a very limited set of circumstances. So we try to identify which test is better for each student using diagnostic testing, and then help that student prepare for whichever test is best suited for him or her. In most cases, there's really no need to begin the process of test preparation for college entrance exams until the summer after sophomore year. This is a good time to do diagnostic testing for both the SAT and the ACT. And many high school juniors will take their exam in the late spring of junior year. We actually recommend that students try to take the exam prior to the late spring. And aim for a test date either in the fall or early winter of junior year. Many students are best served by taking a full-length course that we offer. Typically the courses are designed to meet the needs of students whose diagnostic testing indicates that they scored somewhere in the big middle of the scoring, between the 25th and 75th percentile. So if a student needs help in all of the sections of the test and has a schedule that coincides with when our classes are offered and is comfortable learning in a small group environment of between 5 and 10 students usually, then we recommend taking a full-length course. On the other hand, if the diagnostic testing indicates that a student either scored very high or very low, then we generally recommend individual tutoring. Well, the best way to prepare for either an SAT or an ACT is to actually prepare for it, right? No student should go in and take the test cold. We recommend, of course, first beginning with diagnostic testing to determine which test is better, and then to allocate between 1 and 3 months for a class or individual tutoring. Typically, in either format, once we're done with covering the material, both the content and the strategy, we want students to take several proctored practice tests prior to their actual exam date. Each of those tests is going to be followed by a review session. That will be right after the exam in the case of our classes, or with an individual tutoring appointment a few days after a student takes a practice test.